You might have been told that a little extra weight around the middle is just part of getting older, something to accept, something to live with. But here is what most seniors are never told. That fat sitting deep around your belly is not just about how your clothes fit. It is actually one of the most dangerous things happening inside your body right now, quietly affecting your heart, your liver, your blood sugar, and your energy levels every single day. The good news is this: of all the different types of fat your body stores, this particular kind responds faster to the right approach than almost any other. You do not need to starve yourself. You do not need to spend hours at a gym. You just need to know what you are actually targeting and why. And that is exactly what I am going to walk you through today. I am Dr. Sarah Mitchell, and today we are covering the specific foods, drinks, and movement habits that science points to for reducing this deep belly fat safely and effectively in a way that genuinely works for seniors. Stay with me to the end, because the exercise section contains something that surprises almost everyone, and it completely changes how you think about working out after 60. Before we get into it, if you are new here, welcome. I am Dr. Sarah Mitchell, and every single week I share health information that actually matters for people over 60. Hit that subscribe button right now and join our community. It is completely free, and it could genuinely make a difference in your health. Okay, let us get into it. First, let me explain what we are actually talking about, because this is important and most people have never had it explained clearly. Your body stores fat in two different ways. The fat you can pinch, the soft layer just under your skin, that is one kind. But there is a second kind that you cannot see or feel from the outside. It sits deep inside your abdominal cavity, packed around your organs, your liver, your stomach, your pancreas. This is called visceral fat, and it behaves very differently from the fat under your skin. Visceral fat is metabolically active. That means it is not just sitting there passively. It is constantly releasing substances into your bloodstream that drive inflammation, disrupt your blood sugar regulation, put strain on your liver, and increase your risk of heart disease. It is one of the key reasons why belly fat in seniors is taken so seriously by doctors. Not because of appearances, but because of what it is doing internally, day after day. Here is the encouraging part. Visceral fat, despite being the most dangerous kind, is also the most responsive to lifestyle changes. Your body actually prioritizes burning this fat when you give it the right signals. So let us talk about how to do that. We are going to start with food, because what you eat every single day is either feeding this fat or it is shrinking it. There's very little neutral ground. The first category of food I want you to focus on is colorful vegetables, and there's a very specific reason why color matters here. The pigments that give vegetables their rich colors, the orange in carrots, the red in tomatoes, the deep green in spinach, these are called carotenoids, and they are powerful natural compounds that do something remarkable inside your body. They help calm the inflammation and cellular stress that drives visceral fat accumulation in the first place. Research has shown that consistently eating carotenoid-rich vegetables can actually influence how your body handles fat at a genetic level, turning down the signals that tell your body to store fat and turning up the signals that burn it. The practical message here is beautifully simple. Fill your plate with color. Carrots, sweet potatoes, bell peppers, spinach, squash, tomatoes, leafy greens. Any brightly colored vegetable or fruit is rich in these compounds. This is not complicated eating. It is just intentional eating. The more color on your plate at each meal, the better the signal you are sending your body. The second food strategy involves a specific type of compound found most abundantly in green tea, called catechins. These are natural antioxidants that affect how your body handles fat in several meaningful ways. They support your metabolism, they help your body burn fat more efficiently for fuel, and they actually interfere with how much fat your body absorbs from the food you eat. Green tea also contains a moderate amount of natural caffeine, and the two compounds work together in a way that supports fat burning more effectively than either one alone. If you enjoy green tea, this is a wonderful habit to build into your day. 1 to 2 cups daily, particularly varieties that are minimally processed. Matcha and sencha are excellent choices because they retain more of these beneficial compounds. If green tea is not your preference, that is completely fine. The colorful vegetables we just talked about also contain similar antioxidant compounds and will serve you very well. Now let us talk about movement. And this is the part I want you to pay close attention to, because the research here is genuinely surprising. Studies looking at both diet and exercise for visceral fat reduction have found something interesting. While improving your diet has a stronger effect on overall weight loss, exercise actually has a superior effect specifically on visceral fat. You can lose weight through diet alone, but exercise targets that deep belly fat in a way that diet changes alone simply do not match. Here is the part that surprises people most. The amount of exercise needed to produce meaningful results is much less than most seniors assume. Research has shown that just 2 sessions per week of moderate aerobic exercise, done consistently over a couple of months, produced close to a 50% reduction in visceral fat in participants. Not a small improvement, nearly half, from 2 sessions per week. The intensity that produced these results was moderate, meaning the participants were breathing a little harder than normal and could still speak in full sentences, but were genuinely exerting themselves. Not exhausting, not painful, just purposeful. For seniors, the forms of aerobic exercise that work best are ones you will actually do consistently. Brisk walking, cycling, swimming, water aerobics, even dancing all qualify. The research comparing different types of aerobic exercise shows that the differences between them are small. What matters far more than which type you choose is doing it regularly and at a pace that gets your heart rate up meaningfully. Here is a simple guide for knowing whether you are at the right intensity. If you can speak in full sentences, but notice you sound a little breathless, you are in the right zone. If you can talk completely comfortably with no effort at all, pick up the pace a little. That moderate effort level is where visceral fat responds most strongly. 2 to 3 sessions per week, at least 40 to 45 minutes each, at that moderate effort level is a very achievable starting point. And here is something that should take the pressure off completely. Research shows that the benefits of exercise for visceral fat are dose-dependent, going upward. The more consistently you do it, the better the results. But you are not starting from zero benefit and jumping to results at some distant finish line. Every session counts from day one. One more thing I want to address directly, because I hear this from so many seniors. Do not rely solely on the scale to measure your progress. The scale measures everything at once: water, muscle, bone, fat of all types. When you are exercising consistently and eating well, your body composition is changing in meaningful ways that the number on the scale often does not capture. The research on visceral fat consistently shows significant internal improvements, even when overall body weight barely changes. Your energy, your waistline, how your clothes fit, how you feel. These are much more reliable signs of progress than a single number on the floor of your bathroom. So here is the simple plan, brought together. Fill your plate with colorful vegetables at every meal. The more variety of color, the better. Consider adding green tea to your daily routine if you enjoy it. And commit to 2 to 3 sessions of moderate aerobic movement per week, at least 40 to 45 minutes each, at a pace where you are breathing a little harder but can still speak comfortably. Build consistency before you worry about intensity. Show up regularly, and your body will respond. These are not dramatic overhauls. They are specific, manageable, evidence-based habits that work together, and they work particularly well for seniors because they are sustainable. This is not a sprint. It is a steady, intelligent approach to one of the most meaningful health improvements you can make after 6-0. If this video gave you a clearer picture of what visceral fat actually is and how to address it, please give it a like. It only takes 1 second, and it helps this reach another senior who needs to hear this. And if you are not subscribed yet, hit that subscribe button right now and turn on the bell icon so you never miss a video. Every week, I cover health topics that genuinely matter for people over 60. Things your doctor may not always have time to explain. Take care of yourselves, and I will see you in the next one.